Can I say no to the doctor, to the midwife, to the nurse who's taking care of me during my delivery? As so many of my patients ask. Now, of course, the people who have their birth plans, they somehow never ask this question because they are very clear in their head, okay, yes and no. This is okay, this is not okay. And since they have done this plan, they're pretty okay with saying no, because they know what they're saying no to. But if you have no idea, like in that moment, you don't have a birth plan and you're actually thinking of what if, right? Like you let your brain take care of making decisions in the moment, you'll never know for sure. So, suppose you don't have a birth plan, or you suppose you don't have any plan. Suppose you're just like brand new, you don't know what's going on, you're just pregnant and now you are suffering and doctor is telling you something new, which is like sort of creating a shock in you. You don't know what to do and you want to say no because it's so shocking, but you just can't say no. And you say yes, that's even worse. How can you say no? So first understand, you can always say no. You can say no to whatever you don't approve of. And the person on the other side might create a lot of urgency. They'll be like, hey, something really life-threatening can happen if you say no. Now, unless it's really life-threatening, as in your baby's heart rate is dropping or you're really sick, as in your pulse is not good, your blood pressure is not good, you're having really high fever, or you're dehydrated, like really getting sicker, or your baby's heart rate is dropping or it's very high, these are life-threatening things. Rest all are not life-threatening. But if the person in front of you is actually creating that urgency because they perceive it as life-threatening, because their brain thinks it's life-threatening, you can dissociate and say, you know what, I'm going to come back to it. I would like to think about it. Give me sometimes even 5 minutes. Just tell them, can I take 5 minutes to think about it? And then you can talk to your husband or you can talk to yourself or just take a moment to assess what's going on. You know how people say sleep on it. You don't need to make a decision right now. Even in pregnancy, you don't need to decide. And this is very important skill which comes in very handy after the baby is born too. Because the baby keeps crying and then you have to decide whether I should do this, whether I should do that, whether I should do this, that. It's making a decision. You are always making decisions. I want you to support whatever decision you make. Know your reason why you're doing it. So you can always ask yourself, why do I want to say no? And if it's difficult to think what you're thinking, write it. And if it's difficult to write, talk to someone. Just start talking to somebody about it. If you want, you can talk to your doctor about it. Like, can you explain to me why are you recommending this? Now, the whole time, sometimes you might get really scared asking your doctor these things because you might fear that they're going to lash out or going to say something mean to you or blah, blah, blah. You generally do that. I mean, that's what I would fear if I asked my doctor that. But what if you didn't mean to offend her? You don't mean to like kill her, which you don't, right? But she might think or he might think that you're just like not agreeing with what he or she is saying. I mean, he's an expert. How can you not agree, right? So there is that sort of energy happening and you can completely and totally step into that curiosity and ask the doctor, can you explain more? Like, why do I need to do this? And while they're doing that, bring the energy down, try to understand what they're saying. And then if you still don't agree with them, you start having the conversation on the other side. What will happen if I don't do it? Can you explain then? And what will happen if I do it? They will help you understand because they are experts, right? They will actually, you don't need to go to Google for that. They can actually like answer all your questions. They have all the knowledge. And then whatever you decide, stand by it. Say, okay, I will do this, I don't want to do this. And don't keep on beating yourself for whatever you decide. That's it.